In this episode of our myth-busting series, we'll break down the idea that atopic dermatitis is just a skin disease and show why this pervasive statement can hinder our treatment of AD and how AD goes far beyond the surface of the skin. To begin with, over 90% of patients with AD have mild disease. Mild disease lacks the systemic inflammation of moderate and severe disease. Added to this is the fact that AD can be worsened by environmental factors through exposure to chemicals like detergents and fragrances, which can irritate the skin. Scratching can also exacerbate AD. However, this misleads patients and providers to focus on scratching behavior rather than recognizing AD to be primarily a chronic inflammatory disorder. Finally, many people falsely believe that AD will just go away on its own. This happens with age in about 1/2 to 2/3 of children, with many experiencing lifelong disease. While the true origin of the myth might be lost to time, it's important for us as dermatologists to dispel this myth in order to provide the best care for our patients. So let's explore why AD is so much more than just a skin disease. Over the past few decades, it has become clear that the pathophysiology of AD extends beyond the skin and is multifactorial. It involves a complex interplay between skin barrier dysfunction, immune system dysregulation, skin microbiome abnormalities, and genetic factors. The unique interactions between these factors in different patients can lead to different AD phenotypes and endotypes with unique clinical presentations. It is also well established that a key aspect of pathophysiology of AD is the underlying immunoinflammation, which is driven by Th2 immune responses, with additional contributions from Th22, Th1, and Th17 cells. However, a key discovery in our understanding of AD was the observation that serum cytokines and chemokine biomarkers are elevated in patients with AD, suggesting that AD is also a systemic disease. This discovery was important since it explains why many patients with AD suffer from significant atopic and non-atopic comorbidities, such as asthma, food allergy, allergic rhinitis, and skin infection. These comorbidities add substantial burden to patients with AD and can often complicate treatment. Not only is the pathophysiology of AD complex, but it also creates a significant burden for patients and society. Adults with AD, for example, have higher rates of anxiety, depression, suicidal ideation, attempted suicide, insomnia, and ADHD than individuals without AD. Children with AD are particularly vulnerable. They suffer from impaired sleep due to itch and increased nighttime awakenings, anywhere between 45 to 100 minutes per night, which impacts cognition, mood, and educational performance. On top of this, over a quarter of children with AD are bullied. This often leads to them skipping school and depression. Finally, there's the huge economic impact. The lost annual work productivity due to AD was estimated to be more than €2 billion a year across Europe. While in the United States, this was estimated to be $5.3 billion per year when considering both direct and indirect costs. While it's clear that AD extends beyond the skin, it also extends beyond the individual, significantly impacting their caregivers and family. 61% of parents of young children with AD report disrupted sleep, while 38% of siblings of young patients with AD also report disrupted sleep. Parents of children with AD are also more likely to miss work for caregiving, leading to a substantial economic burden on families. Looking beyond the immediate family, AD also impacts patients' relationships. People with AD are more likely to be divorced, separated, or never married, while 57.5% of patients and 32% of partners reported a decreased libido due to AD. As dermatologists, it's critical that we look beyond the skin when caring for our patients. This is particularly true in AD, which is a complex disease that impacts patients physically, mentally, and socially. If we define AD just as a skin disease, we undermine the true burden of the disease and the weight it can place on patients and their loved ones. By dispelling this myth, we can bring awareness to the complex nature of AD and ensure patients receive the care they require and deserve.